to this wonderful morning at Bangalore. The weather out there in Bengaluru is something phenomenal, which I think we miss across the country, across the world. On behalf of the Apollo hospitals, I welcome you all. I especially welcome our winners today. Well, I always refrain from saying survivors. They're not survivors. They are much beyond the survivors. They are our winners today. And I welcome all the winners here today. Apart from that, I also welcome my friends from the media. That something has to start. And when something has to start, there has to be a spark. And the spark, which is actually started with this support group, and we've aptly called it as CanWin. It is possible.
Here today for this great initiative, and I think it was much awaited, and finally the day has come when we are actually getting it into a reality. I think there are a lot of our patients here, and it takes immense courage for them to come up here and say that, yes, I'm a cancer survivor, and the only purpose for which they have come is to give hope to others.
I'm Dr. Neema Bhatt. I'm a consultant hematologist. So I'm a person or doctor who treats blood disorders. I do bone marrow transplants and also treat children with cancers. So I'm dealing with a set of very specific, very sensitive, very naive patients who have not really been through much therapy. They've not really been through much in life, especially when I talk about children who are being diagnosed with cancer. If any of you know any family or a child who's been diagnosed with cancer, we know as the oncologist for that particular patient that I'm not diagnosing just that child.
Evening, I felt heavy bloating and heavy sweating and also a little bit of breathlessness. Then immediately we rushed up to a cardiologist in Sakra Hospital. They did all the tests regarding to my heart, but all those heart related tests were very normal. So doctor said, because you are having bloating problem and also low hemoglobin problem also was there, so he suggested us to consult gastroenterology department in Sakra.
So going back to the disease and this thing, I think all of us have similar kinds of experience in terms of how the treatment went and how the doctors gave us a lot of hope and strength and courage to fight the disease and get out of it. But one thing that I would like to say, bring it out here, is other than the doctors, the other strength or pillar of strength is the family and friends.
ಅನಿಲ್ ಕಾಮತ್ ಸರ್, ವಿಶ್ವನಾಥನ್ ಡಾಕ್ಟರ್ ಎಲ್ಲ ನನ್ನ ಕಾಪಾಡಿದ್ರು. ನನಗೆ ಜಾಸ್ತಿ ಮಾತಾಡೋಕ್ಕೆ ಬರಲ್ಲ. ದೇವರಂತ ಎಲ್ಲ ನನಗೆ ತುಂಬ ಧೈರ್ಯ ಕೊಟ್ಟು, ಯಾವಾಗ ರೌಂಡ್ಸ್ ಬಂದ್ರೇನೋ ನಮಗೆ ಎಲ್ಲ ಅಪ್ರಿಷಿಯೇಟ್ ಮಾಡಿ, ಭಯ ಪಡಬಾರ್ದು, ಎಲ್ಲ ಸರಿ ಹೋಗುತ್ತೆ ಅಂತ ತುಂಬ ಧೈರ್ಯ ಕೊಟ್ಟು ಡಾಕ್ಟ್ರು ಎಲ್ಲ ನಮಗೆ ವಾಸಿ ಮಾಡಿದ್ರು.
I'm 50 years old. I'm a very super positive and I've been very strong in this, and I've been an avid gymmer. My journey with breast cancer started as of this January, so I'm just 6 months, not even 6 months old in this. And yes, it has changed my life in more ways than one. 2025 didn't start on a right note for me. I think not for many of them it did, as we're seeing it now. I noticed an unusual discharge, and like everybody goes to Google to get answers, and it didn't set right. So I reached out to my sister who is in Apollo, Dr. Kalpana, and she put me in the awesome hands of Dr. Jayanti Tumsi, and she immediately put me through a mammogram, and that was what was advised, and immediately followed by a biopsy.
A year back, almost like 15 months, I think we have gone through. A year back, I had a very minor kind of change in my regular activity, I would say. Certain things which I could not able to perform suddenly. So I immediately connected with one of our local doctor, and he said, why don't you come for a checkup? So then he did a normal checkup, and then he said that, okay, I think you have some rectum inflammation.
Tomorrow is a mystery, and today is a gift. That's why it's called present. I don't know where to start, how to start. This word see, when it hits you very badly. Many of us have gone through this experience, and in my case, all I needed to do was go to Google, and I went to a hospital which is a competitor to Apollo. Somehow I wasn't very convinced, not very happy, nothing to do with the doctor or the hospital. Somehow my heart said, this is not the type of doctor I want, because it was very clinical. An extraordinary chain called Apollo. Apollo has not planted me, they not paid me anything to promote them. Unbelievable medical care, talent, I just can't explain. Words are inadequate. So thank you so much for being there, all the doctors and the Apollo and such hospitals. Thank you.
I call myself a cancer warrior. Reason? I won the war of cancer. Jayanti sitting there. She's my great friend for many years. I am a Rotarian. I used to do camps, breast cancer awareness camp. That's how I caught my disease on time.
And every time I come on the stage, I have this fear. There's butterflies in my stomach, and I feel the floor is sweeping off my feet. And it happens every time, trust me. And all I'm doing out here is just explaining, or rather sharing that experience which I had with the cancer winners. Now, if I have that feeling, imagine what they would have felt when they came on the stage and showed you their vulnerability. You must have noticed that many came on the stage out here and they could not stop their emotions. And that is the power of human connect. The moment they shed the tears, they showed their emotions to you, you could immediately connect. It did take you probably in your past where you had a similar feeling and you could connect with them very well.
I guess these are the words which come across every patient, being a clinician myself and having been into oncology for over 2 decades. These are things which every patient sort of faces when they are given the diagnosis of cancer. What we need to understand is cancer care is no more cut and paste sort of a treatment. One size does not fit all. So what happens is it requires a lot of teamwork, and patients have to be at the center of their care, be it the doctors, be it the nurses. It's not just patients. I think it is also very important for the caregivers.